Thanks, Jess. And thanks everyone who's tuned in here. And I'm really honored to be part of this webinar today, be representing AIHA and our construction committee who put this document together. I'm excited to share about our Focus Four for Health guidance booklet as an initiative for addressing 4 major health hazards in construction. So just a general overview of what I'll cover today. We'll talk about what is Focus Four for Health, why is it needed, who's our target audience, our intended target audience, how did we select the 4 topics. I'll go through the information, the kind of information and the format that we provided, and also what can you do to help participate and get the word out, spread the word and raise awareness for health. So what is Focus Four for Health? It's just mentioned too, AIHA Construction Committee publication published in 2019, and it serves as a companion piece to the existing Focus Four, and I'll talk about that in a little more detail shortly. It's a tool to raise awareness about health hazards and what to do about them in construction. We made it a practical, easy to follow format, and it's a free downloadable document from AIHA. If you Google AIHA Focus Four Construction Health, you should find it there. So who's our target audience? Well, it's of course useful for health and safety professionals and practitioners, but we mainly wanted to get it in the hands of construction employers and employees and all the various groups and trade groups and associations, labor organizations who work with construction to help them get on the reducing health and safety risks on their job site. So I mentioned it's modeled after the existing Focus Four, or Fatal Four, it's also called. Most everyone acknowledges safety is, of course, very important in construction, and it does get some good attention on job sites. The Focus Four approach, we liked that it was widely used and viewed by its stakeholders as a pretty successful program. It's definitely had an impact on safety and injury awareness, which is good and getting better, needs more continuous improvement. There are lots of active site safety programs. There's a lot of guidance available, training, regulations, and the enforcement of safety hazard control is reinforced by an active enforcement profile. So why do health efforts lag behind? Well, the phrase seeing is believing. You know, an unguarded roof ledge is pretty directly observable. The injury is likely to occur on site, as opposed to health hazards where maybe there's an odor or there's some visible dust. Those are not necessarily reliable indicators of how potentially hazardous a substance is. And dust and noise are kind of expected in construction, but the awareness of their actual potential harm is low. So on-the-job injuries also are usually immediate, and that's usually not true for most occupational illnesses. Typically, we're looking at chronic exposures, and it may take months or even commonly years to develop. And so the link to work is also not as obvious. Plus, there's a likelihood of construction workers working for different employers over a career and on different job sites. So it makes it hard to track. And add off-the-job exposures, hobbies and different activities, that complicates it further. And many occupational illnesses don't necessarily have unique symptoms. So training on recognition of health hazards is essential. Hazard communication, common sense isn't necessarily enough. There's also kind of mixed signals from the regulatory or insurance arenas. There are a lot fewer health regulations than safety regulations. I think only 7% of OSHA's construction inspections are on health, whereas about 20% of general industry hazards deal with health. So that enforcement profile is pretty low or lower. Also, the lack of national statistics on health hazards, occupational health illnesses. Reports are published every year about traumatic injury rates and descriptions within each industry sector. So that's got a awareness raising ripple effect for safety. The findings are highlighted, give employers a place to focus, And in general, that's absent in construction for health. There are fewer occupational illnesses reported, as I mentioned, because they're harder to identify and track, so we know they're underreported. And then as a result, there are fewer training resources out there for health. So by writing this Focus Four for Health document, we took a step forward toward pushing that ahead, we hoped. And so all in all, these factors give the wrong impression that health is not a priority, when we know, of course, it is. So we want to turn that around. And again, part of the goal of this document is to help do that, and enlisting your help to do that as well. So how did we select the 4 topics? And I may say this again later, we didn't get into specific individual health hazards per se, and I'll get into that a little more later, actually. So we based our decisions on the 4 topics on our Focus Four on best available information, also our professional experience of the project team and the committee, and also these impact criteria, first, the severity of the health impact on construction workers, how many workers are likely to be affected, how many trades are affected. And we looked at what's the current, or discussed what the current level of awareness about the particular hazard was, and also availability of solutions that employers can use to reduce the hazards. So our final 4 were manual material handling, noise, air contaminants, and high temperatures. So each topic gets its own section in the booklet, and we standardized how each topic is presented, the format and the flow, and each section contains some practical topic-specific tools and techniques that can be used. So as we wrote the guidance document, the project team spent a lot of time on the messages to include. We wanted to make sure we conveyed the impact of the hazard, why it's important, and we wanted to engage contractors and safety folks to take action on health. So we used the familiar template of JSAs or JHAs when we discuss how to look at each health hazard and see the risk factors. And we kept this messaging format consistent for all 4 of the topics. And we wanted our suggested control strategies, of course, to be practical. We also cover a little about regulations and guidance that's out there, focusing on US and Canada regulations and guidance documents. We talk about how trade groups can help. How can industrial hygienists help? What are some takeaway messages? And we provided also additional resources for each of the topics. So we'll do kind of a high-level view of our 4 topics. The first, manual material handling. And manual material handling is the largest source of overexertion musculoskeletal disorders, MSDs. And MSDs account for a large percent of workers' comp costs, so it's an important area to prioritize. Major health impact. They're painful, costly, they're disabling. MSDs are likely to recur, and they affect pretty much every age group and every trade. And they can range from minor sprains and strains to permanent injuries that can impair movement and activity and lead to a lifetime of chronic pain that can be serious enough to hijack a worker's construction career and affect them long into retirement. So that brings me to opioids and prescription pain medications. It's a major issue in construction. Too often, workers are medicated to keep working when they're injured, as opposed to having time off to recover. So construction overdose death rates have been rising terribly. We have 6 times higher rate than the average industry rate. And it's the highest overall number of overdose deaths in all industries, excuse me, among all industries. That's got to change. So prevention is, of course, the key. And some strategies we include in Focus Four are some pre-job planning tools, site and task setup, talking about literal tools and equipment, lighter weight, more comfortable grip, less vibration, and so forth. We talk about how to look at the hazard, the acronym WHAT PACE. We provide that in there, and that's a simple way to remember the different key risk factors that influence the likelihood of MSDs. So for example, weight, the heavier the load, the higher the risk, obviously, Handling ease. Does the item have handles? Can it be carried close to the body? Can the load move while it's being carried? Or does it need to be carried across uneven or slippery surfaces? So those are all risk factors. Awkward postures, very commonly seen in construction, reaching, twisting, bending, and so forth. The time and the distance, kind of obviously, the longer the handling time needed or the longer distance it has to be carried, those two kind of go together. Then, of course, the higher the risk. And so the pace is also important. How many loads per shift are needed? The more loads, the higher the risk. We also provide several links to NIOSH and other assessment tools. The screenshot of the NIOSH checklist, risk factor checklist from the ergonomic guideline that they published in, I think, 2007. So our second topic, noise. We know hearing loss is extremely common in construction. It affects the quality of life and also contributes to other health effects. People don't always think about that. So we need to challenge that assumption of, oh, construction's always noisy. But that is a barrier that we need to overcome. So noise is common and then taken for granted in construction. That's the message we don't want to keep perpetuating. Noise-induced hearing loss and tinnitus. There's growing evidence of sleep disturbance, cardiovascular disease, high blood pressure, other kinds of health hazards that are affected by noise-induced hearing loss and tinnitus. There's also a misunderstanding of the decibel scale. For example, 85 versus 88 dBA, it's more like an earthquake scale. We try to explain to people it's not just a linear scale like temperature, it's a couple degrees warmer, it's exponential. So it's only 3 dBA, 3 decibels higher numerically, but 88 is actually twice as loud as 85 on the decibel scale. So the allowable exposure time gets cut in half. If you can go 8 hours at 85 dBA, you can only go 4 hours at 88 without risking hearing loss. So we also include a lot of sidebars throughout the document with things to know, like this example here, and we have sidebar topics on different noise apps that are available, different hearing protectors, and different topics like that. And in our control strategies, we know in construction we usually default to PPE as a first step, but we know that that goes against the hierarchy of controls, and there are other more effective options. And also, while earplugs and muffs are easy to provide, getting real protection from them takes a lot of good training and understanding and proper use of that. So it's not just a simple, here's the box of earplugs. We know that in health and safety, but it's the quicker solution, sometimes not a good solution, that employers sometimes use. So we advise on focusing on the noisiest tasks first. If you can modify the task or modify the equipment, there's a lot more buy quiet tools out there now, which is good to see. Also moving the task away from where exposing fewer workers, nearby workers, putting up noise barriers. And then, of course, PPE and training, that's down at the bottom of the inverted pyramid, which is our hierarchy of controls. Third section is on air contaminants, and many construction tasks, of course, generate air contaminants. Dusts are created when materials are disturbed by cutting or grinding or sanding. Metal fumes and gases generated during hot work, like welding and torch cutting. Vapors are created when solvents and products evaporate into the air during use, and equipment emissions produce exhaust gases and particulates. So, and biological, the COVID pandemic made people more aware of biological hazards, I suppose, and what we breathe in, and it allowed N95s and PPE to enter more people's vocabulary, but that's a good awareness raising tool. We certainly don't cover that in the book. So more about air contaminants. The key message is, again, air contaminants are common, but awareness about the potential harm is low. One factor is the delayed onset of illness and symptoms for many health effects. So And also, there's not a lot of awareness that air contaminants can affect more than the lungs and respiratory system, can also harm other organs. And there's a blind spot for shorter, infrequent tasks that can nonetheless produce intense high exposures. There are some tasks and exposures that are so high that even if they're only done for a few minutes a couple times a day, they can still cause an overexposure when you're looking at an 8-hour time-weighted average. So for control strategies, Focus Four walks through the JHA process for air contaminants and looking at factors that can affect the potential for exposure concerns, like the amount and duration of the use, the general work environment, the kind of space they're working in, tools and equipment. Do they disperse contaminants into the air like sprays or saws or drills? So different factors to look at in a JHA type of approach to controlling air contaminants. There are a lot of sidebar topics that we provide for air contaminants, and I'll mention here more specifically, we did not get into individual specific air contaminants. Those would take books on themselves, you know. So we do talk about asbestos and lead in a sidebar because those are still very common and pretty well known in construction. So we have sidebars on other topics like how toxic are they, what are safety data sheets, and we also talk about how many of the OSHA's PELs, permissible exposure limits, are outdated. And we talk about selection and care of respirators as well. So a lot of different points a contractor or a safety and health person should know. And in talking about control strategies, for air contaminants, as other safety and health hazards, we should be guided by the hierarchy of controls that should guide our thinking. And that basically helps us rank order potential solutions based on their effectiveness. First, ideally control the hazard at the source. If you can eliminate it or substitute a less toxic product or process, and if you can't do that, then try to control the hazard along the path between the source and the worker using engineering controls such as local exhaust ventilation or wet methods for dust like shown in the picture. And then the last choice option is controlling at the worker with PPE. So last but not least, our high temperatures was our fourth topic. And this section discusses various factors that aggravate heat conditions and provides a lot of safety tools as well. So our key messages, absolute key message, focusing on acclimatization and new workers. Preventing heat illness needs a program approach, and acclimatization is essential. There's a recent study of occupational heat-related deaths over a 20-plus year period that although construction makes up 6% of the workforce, we had 36% of all occupational heat-related deaths in that time period. And in 2012, OSHA investigated 20 heat illness cases that involved 13 deaths. And of those fatalities, 9 occurred during the first 3 days of the job. And 4 of those 9 occurred on the very first day of the job. So if we don't focus on newer returning workers, we are missing the boat on controlling heat illness. There are no federal guidelines, no federal standards yet, but OSHA has a national emphasis program, and they are working on a proposed rule, I believe. There are a number of states, including Oregon, has a new rule, a heat rule. So state rules, Canada uses the threshold limit value, the wet bulb temperature. So anyway, those are some of the key messages, along with discussion of different factors that aggravate heat conditions. So we talk about working in direct sunlight and the impact that has. We talk about clothing, different types of materials, use of respirators and other PPE, hot work, carrying weight. So lots of different factors that affect worker susceptibility to heat-related illness. Also, what people don't necessarily realize is that there are some safety injury risks that come from high temperatures. You working in hot weather, sweaty palms, you can lose your grip. Fogged safety glasses can cause trips and falls. Dizziness, one of the symptoms of heat stress. Hot surfaces can cause burns. So the health and safety are certainly interrelated very closely. So some final points to think about. Health hazards can have real impacts. For example, workers can dry cut into concrete a couple times a day and not experience any symptoms on the job, but possibly 20 years later, they may have breathing problems and wind up on disability. So our take-home message, we need to raise awareness about health. We also need to generate more action to address health. There are lots of opportunities to do that. For example, every time a contractor buys or rents a piece of equipment, there's an opportunity to get a model that's less noisy or that has local exhaust ventilation built in. The silica standard actually raised awareness and action on that as well by requiring integrated dust and or water control. We need to make health less mysterious and more familiar. So, okay, that might be a little dramatic or overgeneralizing, but industrial hygiene has this kind of image sometimes of being complicated, and that's an obstacle. It does take skills and abilities beyond just hanging a pump. I hate that phrase, but the Focus Four document is based on the idea that packaging health into familiar safety templates, such as JHAs, JSAs, can help get some traction and get more uptake, and more of that is better. It's probably an underutilized tool, a resource for health, but it's a wonderful, JHAs are terrific for that. Also, somebody mentioned earlier in advanced question, I'll bring it up here, that if OSHA, they asked if the OSHA Training Institute was including Focus Four for Health in their safety training or in the 10 and 30 hour class. I'm not sure if they asked it that specifically, but we would certainly like that. When I used to teach in the 10 hour, OSHA 10 hour, there was 1 hour that covered a whole bunch of health hazard stuff in the whole 10 hours. So we're a minor player there. We need to elevate that. But also we talk about, safety and industrial hygiene collaboration. Since IH involvement on every construction project is not feasible, our hope is to get contractors and safety folks more involved with health, which will hope to reduce health hazard risks and generate more beneficial activity, and importantly, a more informed workforce. So we hope you'll take a look at the Focus Four for Health document and glean some ideas you can use to take action on health on your job sites. And lastly, like the original Focus Four for Safety, it's a great vehicle for partnerships with local groups and national organizations and associations. So we hope you'll look to participating in some of those. So with that, I thank you on behalf of the whole Focus Four Construction Health Project team. Here's my contact information if you have any questions or would like to share some ideas on helping spread the word. So thank you again, everyone. And now I'm happy to turn this over to Sarah Brooks, industrial hygienist at CPWR, who will tell us about a wonderful tool that CPWR has developed, the exposure control database.
Thanks, Barb. So Barb did a really good job of explaining why it's so important to give health hazards the same consideration that we give safety hazards. And I'm going to talk a little bit about a tool that we've developed here at CPWR that helps people calculate, or better said, estimate the exposure that workers might be dealing with on construction sites under different circumstances. So just a quick background on CPWR. We're a nonprofit established by NAB2 in Silver Spring, Maryland. We concentrate on research, training, and service, and we also serve as NIOSH's National Construction Center. Our mission is to reduce occupational injuries, illnesses, and fatalities in the construction industry. So the tool that I'm going to talk about today is the exposure control database. It is a database of exposure measurements that we've gathered from published literature, government reports, and partners in industry. It has measurements for 4 hazards: silica, noise, welding, fumes, and lead. It's interactive, web-based, and it has quite a few measurements in it at this point, as you can see. It's a way to highlight the effectiveness of engineering controls primarily, and it's publicly available to anybody who wants to use it free of charge. It was originally launched in 2018. It was developed by myself and Dr. Babak Mamarian, who is the Director of Exposure Control Technologies Research here at CPWR. And the target audience was originally intended to be small to medium-sized contractors. I think probably a good chunk of our users do fall into that category, but it's I think it's useful for anybody, for any size contractor. So here is the landing page and the address of the ECD. I'll do a couple example searches in a second, but first I want to talk about the different branches: silica, welding, fumes, noise, and lead. So the silica branch is kind of our most often used branch. The large majority of the people who use it are coming to it to get data on silica. Most of the measurements that are in this database are from facilities that fall under the 1926 construction standard, but a small number are from facilities falling under 1910 general industry, if we feel like the work processes are identical to ones that might be performed on a typical construction site. So all of the silica measurements that are in this database are task-based. They are personal breathing zone measurements, and they are taken both on construction sites and in lab settings. Although you cannot combine them or view them together, you can select which one you would like to look at. All the measurements should represent typical processes, and all of them can be attributed to a single task, tool, and control method. So a single tool, we want to be able to attribute silica exposure to a single task and tool. We exclude worst case measurements or measurements taken for compliance purposes. And we also don't include measurements that are generated through computer simulation. So for example, if an article has let's say they collected 16 measurements and they give a mean and a standard deviation, we would not attempt to recreate those measurements on a computer. Over the past 12 months, about 2,800 people in the US and 118 other countries have visited the ECD, including people from universities, private companies, nonprofits, insurance companies, contractors, local unions, and government agencies. The welding, fumes, lead, and noise branches, although they are used a little less frequently, still have a lot of good data on them. The welding fumes branch includes measurements taken on live construction sites only, although we may revisit that in the future. And multiple analytes per measurement are provided where they are available. So for example, if somebody collected data for total particulate and manganese and hexavalent chromium, we would include all of those measurements. The lead branch includes measurements that are taken at sites that fall under both the renovation, repair, and painting rule and the abatement rule. And the noise branch right now only includes measurements taken in a laboratory, and it's a little different from the other branches because we display the results as a percentage dose for a day's work according to both OSHA and NIOSH criteria, which I will show you in just a second. So I'm going to do a quick walkthrough of our website. And just a disclaimer, for those of you who are familiar with Table 1 and the new silica standard, you'll notice that there's a good bit of crossover between what's in Table 1 and what we have in the exposure control database. Although we do have quite a few measurements for task tool combos that are not on Table 1. Actually, a few of our measurements are taken directly from the sources that OSHA used to develop Table 1. But we just want to be clear that the exposure control database is not meant to be a compliance or legal tool, and that it's not necessarily intended to serve as a source of objective exposure data, which the new silica standard says can be used in lieu of Table 1. You can, however, use the ECD to find data for specific task tool combinations, and then you can visit the original source and make your own judgment as to whether that would fit the definition of objective exposure data under the standard. So I will share my screen. All right, so when you first go to the ECD, you are on this landing page here. I'm going to do 2 sample searches, I think, for silica. So you click on the silica icon, you come to this page with 6 drop-down menus, and that is where you select your task tool, material, control method, environment, and what type of data you'd like to look at. So I'm going to run a search for something that is not on Table 1, just to kind of give an example that the data might not be as available for. So let's say I am performing abrasive blasting. Then I would move down to the tool. Let's say we're using silica sand. We are blasting concrete. And let's say that we are using wet blasting and that the silica sand that we've purchased, the company has removed the fines from that blasting media. We'll be blasting outdoors. And it looks like for this particular scenario, we only have data available from an actual active job site. So I'm going to select that. And then you click the submit button and you are presented with the results page. Up here at the top, you can see a summary of the search that you selected on the prior page. And then on the left, you can see your expected exposure if you are performing this work under these circumstances, which in this case is 62 micrograms per meter cubed. We plot that against the OSHA PEL and the OSHA action level. So for this particular scenario, we can see that we are above the PEL and would likely need PPE, although of course abrasive blasting does have some pretty strict requirements for PPE, so you would likely want to continue to follow those. And this particular exposure is based on 10 measurements that we have in the database. The largest is 130 micrograms per meter cubed. The smallest is 16 micrograms per meter cubed. And this particular graph shows the distribution of measurements. So we can see that 10% are below the action level, 30% are between the action level and the PEL, and 60% are above the PEL. We also provide some useful resources here that we think might be helpful. And then the sources will tell you where this data comes from. So it looks like these 10 measurements are from an article from Dr. Heitbrink from 2007. So I'm going to go back and perform one more search to show you how the results page can differ depending on the results you get. I'm going to pick mixing mortar as my task. A powered mixer. And just to note that if you don't see the option you're looking for, it just means that we don't yet have data from that scenario. So if you have data that you'd like to consider sharing, we would add that and would help expand the database and make it more applicable to everyone. So let's say I'm not using a control method and I'm mixing outdoors and looks like we have job site measurements available. So I will submit that. And in this case, since we only have 2 measurements for this scenario, we would just display those measurements individually. An average isn't particularly meaningful if we have 5 measurements or less. So if there are less than 6, this is how your results page would show up. And then we can go down here and see that these particular measurements are from the Ohio Bureau of Workers' Compensation, which has been super helpful in providing us with measurements. You can also see we have the home, the option to return home. You can click on history to see your prior searches and view your results again if you'd like to. Glossary for terminology, and data collection forms, which I will discuss in just a minute. So I'm going to return home and I'm going to do a quick example search for welding fumes. This looks a little bit different because the important things for work that may produce fumes, there are different considerations. So let's say I am doing shielded metal arc welding. I'll be using 6010 and 7018 consumables. I'll be welding on carbon steel. And let's say I have some local exhaust ventilation set up. And I'm going to be doing this welding indoors. I can click submit and it would show me a summary of what I put in the prior page. And then it looks like for this particular scenario, we have data available for total particulate and also for manganese, but just those 2. So the graphs will look the same more or less for total particulate. We have the PEL, and because there's no federal OSHA PEL for welding fumes total particulate, this database uses the Cal OSHA PEL of 5 milligrams per meter cubed, which is an 8-hour TWA, as are all the other exposure limits. So this particular search gave us 14 measurements. The average is 3 milligrams per meter cubed for total particulate. Most of the measurements are below 5 milligrams per meter cubed, but some are above. We have a maximum of 5 and a minimum of 1. So that is, some cause for concern. In terms of exposure to manganese under this situation, looks like we also have 14 measurements, and the vast majority are between the ACGIH-TLV and the NIOSH-REL, which are the 2 occupational exposure limits that we believe are most relevant for manganese. They're pretty far apart, so I would say that probably you should take some caution with this one too, and that good respiratory protection or maybe getting your local exhaust ventilation upgraded or looked at would be a good practice. These particular data come from 3 sources down here, which you can visit if you're curious to see the source material. I am going to return home and perform a sample search for lead. Lead is our smallest branch, but it still has some good data in it. So let's say I am excavating and replacing lead pipes. I'll be using a backhoe and shovel because that's what the data we have is for, doing this outdoor, during a residential renovation project, and I will not be using any control method. So it looks like under these circumstances, our expected exposure for lead would be 3 micrograms per meter cubed, which is well below the PEL and the action level. We can see that the distribution is pretty encouraging here. And we can see the sources down below. I'm going to perform one more sample search for noise, which is a little different than the other hazards because we present the results in terms of a percentage dose. So let's say I am working with a hammer drill. I know it's a Black & Decker, but I'm not sure what the model is. I'm going to be working on concrete. And let's say I'm going to be using this hammer drill for 1 hour and 15 minutes during my shift. I can set that time. And then let's say that during the shift, I'm also going to be using a grinder. I can click yes. It'll put what I've already entered at the top. And then I can go back and input the grinder. Let's say I'm not sure what who the manufacturer is and who the model is in this particular case. I'll be working with concrete. And let's say I'm going to be using this grinder for about 45 minutes. I'll set that. That's all the tools I'm going to be using during my shift. And I will submit. So here at the bottom in this table, you can see a summary of what you put in the prior page. Black & Decker hammer drill on concrete for 1 hour and 15 minutes, and a grinder on concrete for 45 minutes. And it will show you the individual decibel levels of each of these tools if you're curious. So if I were using both of these tools for 1 hour and 15 minutes and 45 minutes respectively, in terms of the OSHA criteria, my dose would be 73% of the allowable daily dose. However, in terms of NIOSH criteria, which are more protective for health, your dose will be 5 times higher than recommended. So in this particular scenario, I think we could recommend hearing protection, perhaps double hearing protection, and we would want to be very conscious of how long we were having people use these tools for. The bottom is about the same. The source of these measurements is the NIOSH Power Tools database. And I'm going to return to the presentation. So some of the challenges we had with data sources are data availability, data quality, and inconsistency in sampling methods. Most data in the literature that we've seen is given as summary statistics, which we can't use. If the actual measurements are available, sometimes the control method might not be mentioned, or it could be a worst case measurement, or the person being sampled might have used multiple tools during the sampling period, so there's no way to attribute the silica exposure to a specific tool. As a solution to this, we have developed 3 sampling forms to streamline the data collection process and improve data quality. And as of right now, we have a form for silica, a form for noise, and a form for welding fumes. So here is just a photograph of the top of the silica form. It's available at the link at the top of the page, as well as in the exposure control database on the upper right-hand corner in the drop-down menu. And this form can be used as a fillable PDF, or it can be printed out. And here is our data collection form for noise, which looks a little different, and our data collection form for welding fumes. These forms are all free online for anyone to use on their projects, but we would also love if you would share your data with us to put in the exposure control database if you're able. The more data, the better, the more reliable the system will be. And if you happen to have data that's in another format and you don't have time to transfer it to this form, that's fine too. As long as it has all the required information, please feel free to send it over to us as is. So thank you very much. I think we will turn it over to Jess for Q&A. And if anybody would like to get in touch with me, if anybody has any questions or comments related to the ECD, please don't hesitate to reach out.
Great, thanks, Sarah, and thanks, Barb. We do have plenty of time for questions. And I saw a few come in as we were going, but also feel free to type in your questions now. I wanted to start with one or two that we got submitted in advance. I think, Barb, you sort of already answered the one question about the OSHA 30-hour construction industry course, and it has the OSHA Training Institute indicated that the AIHA Focus Four for health be included. And I just wanted to follow up on that to say that we got a chat from Robert Braun, who indicated that the UTA OSHA Education Center does provide the booklet in the OSHA 510 and 500 courses. So that is great. And then Sarah, we had a question in advance for you that said, I hope to learn more about non-obtrusive silica monitoring devices that asphalt plant personnel could wear during their shifts. Because the plant is not covered in Table 1, folks need creative ways to monitor and protect workers.
Okay, so by non-obtrusive, I guess I'm assuming you mean not as heavy, not as bulky, not dangling around in front of the work. Unfortunately, right now, I don't think there is much besides the standard IH sampling method for silica, which involves putting a pump on your belt and then a tube up to a inlet, which you hang right by your chin or your breathing zone. Most pumps right now are about a pound. I know there are a couple others that might be a few ounces lighter, but they have some issues with them in terms of reliability, so I would hesitate to recommend them. I think in general, pumps are getting smaller as the technology advances, but two things I would recommend. Number one, maybe duct taping everything down if it's sort of jingling around, getting in the way of the work. And another thing is that you could decide to do area samples instead, but you have to be really cautious with those because they are not representative of individual worker exposure. They stand in the same place all day, so I would interpret those with caution.
Thanks, Sarah. And just to follow up with that, we had a comment in the Q&A that said parallel particle impactors are lighter than cyclones. They are NIOSH certified and easier to use, so also make a good non-invasive option for sampling.
Okay, thank you.
Thanks, Sean. Okay, next question, Barb, related to health, do you see the AIHA addressing mental health, stress, suicide, etc., and workplace violent issues in construction? And I know you're actually with the AGC, but I don't know, based on your time on this committee, if you can speak to that.
Well, actually, that's an excellent question and an important topic. And in some of my notes, I did talk, I was going to say something about total worker health and mental health. AIHA has, I don't know if there's an actual committee or working group on the subjects, but it has been a topic that has been addressed more often. And I know on our construction committee, we've definitely talked about mental health and suicide prevention, and not sure what that might look like going forward in terms of guidance or activity, but I know there were a lot of topics presented on total worker health and mental health, maybe not a lot, but a number of them at the AIHA conference, the AIHCE EXP 2022 last month, was that? So it is for sure. Thanks for bringing that up.
Okay, the OSHA TWA for general industry is 85 dBA, but construction is 90 dBA. I never understood that. It's not like construction workers' ears are any different. Do you know the reasoning?
The OSHA PELs are how many decades old? And a lot of the construction, yeah, actually that's a problem that's even larger than the discrepancy between the noise PEL for construction and general industry. I share your frustration. They're outdated.
All right. Well, with that, oops, sorry, one person just asked about the recording and follow-up. Yes, we will be sending that out and posting that. And with that, I'd just like to thank everyone for joining today. Thank you, Barb and Sarah, for excellent presentations. And I believe both of you included contact information for follow-up in the slides, or everyone is welcome to reach out to me. So have a great rest of the afternoon.
Thanks, everyone.
Thank you.